What's happening? Oh, in because you're in the lobby. So I just logged in right now and it says view lobby. So let me let you in. That's all it is. And Gary just joined too. So that's it. It's
really close here.
you are good, sir. We are on, and there is Gary, and I can't see who else is there yet. I got to get my screen set. So thank you, Matt.
Thanks, Dominic.
Good morning.
Good morning, everyone.
Good morning.
Good morning.
Good morning.
Good morning, everyone. We're just waiting for people to join on in. We're still a few minutes prior to the meeting time start.
Great. Everybody quiet.
And is that you, Eileen, at 505-589-1183?
That's Brenda. I'm Brenda Betalio.
Okay.
Is you Dr. French?
It is.
Awesome. Yeah. Time for the meeting.
Hello there.
Hello.
Good morning, Haley. How are you?
Good. How are you, Gary?
Doing well. Let's see. We have 1, 2, 3, 4, 5. Yeah. Okay.
Good morning, everybody. This is Dominic. We're just giving everybody another minute or two to get logged in.
And I was just going to cast my vote that Mateo has the best office because it's got a ping pong table.
I think I can agree with that.
Do you guys not have ping pong tables in your offices? I'm confused.
I know I thought it was standard office equipment until I went to work for the state.
Oh.
All right. I think that's about enough time. I think, Eileen, I'll turn it over to you. I don't see Martin here on the list.
Okay, that sounds good. And my apologies that I don't know what's going on with our internet, here we are. But thank you everybody for joining today. And thank you for the work that you do to take care of patients, communities, really of each other. And for those of you who are not sure, since of course we meet infrequently, I'm Eileen Barrett and I am the vice chair for the committee, and usually Martin is our chair. I suspect something must have come up for him. And I hope that he's able to join us belatedly. And you may have received our email that included the agenda for today. And I think that maybe what we'll do, and with my apologies that I can't share my screen since I'm on my phone, or maybe that technology exists and I just don't know how to use it. But then I think that if we have some introductions, I think that would be really helpful. I know that I've been prattling on a long time here, but maybe I'll ask as we go to everybody else who's joined the call, that I'll ask you to say maybe your name, where you're from. Last time I think we said the best place to get a burrito, and I'm going to ask you in New Mexico, and I'm going to ask you maybe if you can say what kind of chili you like. So Eileen Barrett in Albuquerque, and I think that I've always been a green chili person, but more recently I've come a place called Cucina de Luz. So with that, and going through our list of attendees, I know that the order of people can change on our screens. I will ask if maybe the next person to go is the goodness, I don't know that attendee, and their last two phone digits are 83. So maybe I'll ask if Alan would be able to unmute yourself, say your name, where you're calling from, and favorite chili.
Good morning, Alan Plymale from Deming, and I'm absolutely addicted to green chili.
I like it. Thanks, Alan. And then next, Rosanna.
Yes, my name is Rosanna Archuleta, and I am from Santa Fe, New Mexico, and I like both red and green chili. So none in particular, just both. Christmas.
Okay. That sounds great. Thank you. And colleagues, I'm going to ask you for your forgiveness on two things. And one of them, what I should have said, is that I'd like us all, I hope that we can all feel comfortable referring to each other by our first names. I know that there were people here who have PhDs and MDs and a lot of really advanced degrees. I think that it can be good for psychological safety if we all just refer to each other by our first names. The other thing is also I would feel welcome, ask you to feel welcome to indicate your pronouns either when you're introducing yourself or on your little bio that's there. I should have said that I'm she, her. So with that, I think that maybe what our next person is Kathy.
Morning, Kathy Jerry, she, her, calling from Albuquerque, New Mexico, and I prefer green chili. Thank you.
Thank you. And next, Eleni.
Good morning. I'm Eleni Bukavalis. I'm calling in from Placitas, just north of Albuquerque. She, her pronouns, and red chili.
Thanks. And next, Elizabeth. And it might be that Elizabeth is not in a place that she's able to unmute herself, so maybe we'll circle back and next go to Gary.
Yeah, my name's Gary French, he, him, and I prefer green chili. I'm migrating toward green nowadays, so yeah.
Thank you. And next to Hallie.
Hallie Faust. I'm calling from Madrid, Spain, actually, my first time here, and I'm very surprised that they don't use chili. I was expecting, I guess, something similar to New Mexico. I'm not sure. Best I can do for you.
Impressive. Thank you for joining us all the way from Spain. That's impressive. Thank you. And next, Brenda.
Hi there, I'm Brenda Bates and Lyle, and I'm from Albuquerque, New Mexico, and I love green and red.
Nice, thank you. And I'll ask, I think it's statewide, but I don't know if it's really more of just the Santa Fe area that green and red people often respond Christmas. Not sure. Anyway, thanks. And next, Matt.
Matt Clark, Emergency Services, Alamogordo, Otero County. Green is preferred, but I also like Christmas, and yeah.
Okay, thanks. And I guess now we know our answer that Christmas is also an answer in Alamogordo. So thanks. And Matthew.
That's me, right? Mateo,
Yes,
green all the way. I've been here for 10 years. The last time I had red was 9 years and 11 months ago.
Okay, impressive. Thanks. And Andrea, forgive me, I should know which pronunciation you prefer.
I don't have a preference. My mom called me Andrea, my dad called me Andrea, and I love them equally. So I have no preference. Andrea Sundberg, Health Program Manager for the Medical Cannabis Program, and I'm definitely a green girl. I like green chili, especially if you go to El Pinto, the fried green chili strips. Highly recommend.
Okay, I feel like I hear a suggestion for our next meeting. And Dominic.
Good morning, everybody. He, him, and his. And I will say, while I usually am a green chili fan or Christmas, lately I have to admit my favorite pepper has been my habaneros that we grew in our garden this year. So I have to go a little sideways on that. But yeah, which by the way has ruined me for other peppers. They're just not spicy enough now. It's kind of a problem. Thank you. And
That's exciting. Oh.
Eileen, I think we actually have two Brendas on the call.
Oh, thank you. So I would love to, thank you so much for that. And I would love to hear from our other Brenda.
Our other Brenda is in the office today, and I believe she might be on a call.
Okay, all right, thank you. And maybe then I'll circle back to Elizabeth if she's now in a place that she's able to unmute herself.
Hi, yes, Elizabeth Bisio. I am calling from Albuquerque. I prefer red chili. Though I'm from the Midwest, so I have a little bit of a muted taste, and so anything feels really spicy to me.
It's like, ooh, black pepper. Just kidding.
Yeah,
I'm from the Northeast, so it's like that for me
exactly.
too. I totally get it. Yeah, thank you. And thanks. And there's an attendee who's calling in on their phone who I can see that it starts with a 5 and that it ends with an 83. And I'm sorry that I don't know who that is so that I can call on you by name.
That's Brenda. That's another Brenda.
Ah, okay, great.
I'm the first Brenda.
Ah, okay. All right. Thank you for helping clarify that. I appreciate you and I appreciate that.
Sure.
And yeah, and let's see. So with that in mind, then thank you again for everybody for their introductions because it's a little bit hard to navigate on the phone. I would appreciate, I know Dominic in particular, you're always so helpful with helping point out if someone joins the call late, in which case then I would love if you can let me know so I can make sure that I'm not ignoring them. And I know that, yeah.
Oh, and Eileen, sorry to interrupt, but speaking of which, we did also just have another person join, Chris Woodward. Chris, if you could introduce yourself. We're doing a favorite type of chili, green or red, and where you're from. Chris, if you're speaking, you're still on mute.
Sorry, I'm having some computer issues. Can you hear me?
Yes, we can, Chris.
Yes.
Hold on. Hi, I'm Chris Woodward. I'm an attorney with the Department of Health, and I work with the medical cannabis program. And what was the question again?
Red or green?
Thank you. Okay. Yeah.
I'm more of a red person, honestly. You know, once in a while green hits the spot, but I'm kind of a red person.
Okay, no judgment. We like to hear it. Thank you, and thank you, Dominic, for helping me see that. I'm going to apologize because I don't have it pulled up, but I know that often we. I will ask if one of my colleagues would be from the DOH would be able to share the land acknowledgement, or maybe that might be something that is already planned.
Okay.
And you already have it on the agenda elsewhere.
Thank you, Eileen. I don't actually have it as an item to pull up, but I do have that as part of our update from the medical cannabis program. But I'll go ahead and say it now that essentially we acknowledge the unceded lands that we live on and work on from the Native American tribes, pueblos, and communities here in New Mexico, and want to make sure that we honor them with respect and dignity in the work and what we do here in New Mexico.
Thank you. And I think that that's a great segue to the update from the medical cannabis program. And although I'm still here, I will turn off my camera. Thank you.
Great. And this is Dominic, and what I'm going to do is one of the things that we had decided as the program, because we have so many presentations that we do, is we are just updating our data for slide presentations every quarter. We're still actually gathering the data from August, so we don't have a new slide presentation with comparison to the one we just provided in our last meeting just yet. But what I'm going to do is I'm going to share our monthly report from the end of July. So this will show the statistics at the end of July. This, by the way, is located on our program website. And so if at any point someone wants to see them, you can just go to the website and see actually the last, it's almost 10 years worth of data within these monthly reports to be able to get an idea of where the program is going. And one of the things we did add to this is at the end, you'll see we added several graphs that actually show what the program has done over the last few years and over the last 6 to 7 months. So give me just a moment. I am hoping everybody can see my my screen now. Okay, I see heads nodding, so fantastic, thank you. And so with this, you can see that the number of active enrolled patients at the end of July was 130,000. Now, I can tell you that that number has dropped a little bit in August. Again, we're working on some of the final numbers. What we see right now is a combination of things happening with regard to the patient enrollment. Part of the reason for some of this dropping is because we just hit at the end of June the first time that our 3-year cards for patients have actually started to expire. Now, what I mean by that is the program traditionally had a 1-year card where patients had to enroll every year. But in 2019, the statute changed where it became a 3-year card instead. And so what then began happening is 3 years ago, as of this past June, we started issuing that 3-year card. And as many people may realize, is just like with driver's licenses, there are many people who get to the card expiring and then they suddenly realize last minute, oh, I've got to go renew this. And so what we have been seeing here since the end of June and in July and August is many of those individuals who didn't realize their card was expiring are suddenly being caught off guard and have their card expires on them. So we are getting a lot of calls in the office from people who are a little bit in a panic, who are saying, my card just expired, what do I do? And we're, of course, guiding them through that process. But because the process does involve going in to see a medical provider, that can take a little longer than just a week or two. And so we're starting to see some changes within the number of people who are actually applying each month. But the number's not really dropping. What's really happening is we have this 3-year lag. And so we're starting to see that effect at this time, where people who enrolled 3 years ago, and some of those individuals may be people who enrolled, tried cannabis a few times, decided it was not something that was beneficial for them, and so just are never going to reapply. In the past, we saw that happening each year. Now we're seeing that happen just because it's at the end of the 3 years. We also know that there are some people that with the advent of adult use cannabis are probably turning around and saying, I don't really need to go through the process of enrolling. I'll just purchase on the adult use side. We also are getting those phone calls in the office of people who start to realize when they do that, that they're getting charged the 20% tax. And now we're saying, we want to get back in the program. So we're seeing a little bit of a lag. We anticipated this in the program. We anticipate the numbers to continue to reduce for a couple more months. But then, as we saw in Colorado and in several other states where they had similar patterns, the numbers will stabilize and then they'll start to go on up. We think our difference, we have a little bit more of a difference due to that 3-year card lag issue and expiration date issue. Any questions on this at this point? I know that was a lot right in one little bit for one piece of data, but are there any questions about this? Yep. Okay. And so continuing moving through, here is just a little graph showing the number of patients by their indicated primary condition. And as it has been through, well, for the last several years of the program, PTSD being the number one condition, severe chronic pain, and then cancer being in the number 2 and number 3 slot. I do have another graph here in just a little bit that will actually show that with year by year ranking as well. And then here we have the enrollment by county. And let me reduce this just slightly. So on this graph, of course, we have both the table and the map for New Mexico showing how many individuals are actually enrolled in each county within New Mexico. And once again, the highest counties for enrollment are Bernalillo County, Santa Fe County, and Doña Ana, which is not a surprise considering those are also the largest population centers within the state. But I also want to make sure that it is pointed out we do have patients throughout the entire state in every county. So even our small population counties do have individuals within the program. And so the next couple of slides are about ethnicity and race. Again, these have not really changed very much since the last meeting, so I'm not going to go into detail with regard to them. They have stayed very stable and have not really changed very much. One thing that we do see that is happening, because we only instituted the questions with regard to the gender or the sex at birth, and then gender identity currently, because we only implemented those a couple of years ago. We are gathering more data and we see more responses on that every month. And again, that is in part because we didn't have that 3 years ago. So as those individuals who have that 3-year card expire, they're starting to answer those questions as they're re-enrolling. So we anticipate that improving. And Eileen, I saw you had a question in the chat. Sorry, with sharing my screen, it's a little difficult to see the chat as well. Let me just get to that. Oh,
That's
are
okay,
there
Dominic. I can read
significant?
it for you.
Sure, I just got to it.
Okay.
Are there significant per capita differences? Not really. It's slightly different, but not by very much. If, for example, let me go back to here. Now, we don't have it in percentages, but you can see in ethnicity, there's 39,000 individuals who reported as Caucasian, and then 33,000 individuals who reported as Hispanic or Latino. Now, the other thing with it is this data is not a required part of enrollment. So there are many people who actually do not answer the question. And to me, looking at it from a research standpoint, I always look at it as I would actually like to know a little more about the people who elect not to answer the question or these particular questions on demographics to see if there somehow is a difference there. However, when we've done the other surveys with some of our contract partners and our internal surveys, the data fits very closely to the population within New Mexico. So great question on that. Thank you. And then the next one are individuals enrolled by age. And of course, here we have it both by the actual number of individuals and then in percentages. And again, it is relatively stable across the various age groups, starting in the 20s, really going all the way up into the 60s, with, of course, still having some higher levels within the 30 to 40 age group at just under 20% of the program population. And then again at 18.5% in the 61 to 70 age group. And again, this has been very stable throughout the last several months that we've been tracking and displaying this information. And then here we have the 5-year enrollment trends. And as you can see, what we have here, oh, and this is actually duplicated on this, is we started back in 2018 with just under 60,000 patients, and we have now in 2022, 130,000 patients. And while that has dropped a little bit from our peak at 134,000, it still is not very much of a difference in the number of people enrolled in the program. And then this is showing the monthly, oh, and I'm sorry, it was 135,000, not 134, but this is showing our monthly trend over the last 6 or 7 months since December of 2021, so that you can actually see what is happening with the enrollment in the program currently. And then the number of patients enrolled based on the 3 most commonly enrolled qualifying conditions. Here again, they stay relatively stable with regard to PTSD, severe chronic pain, and cancer. And this is going again over the last 6 to 7 months since December of 2021. And then this is showing those same 3 conditions based on each year for the same month, so July to July, 2018 to 2022. And so while again, it has been an increase from a percentage of the number of people who are enrolled in the program, there's not actually very much of a difference. And again, the reason I say that is back in 2018, for example, with PTSD, even though it is just under or just over 29,000, at that same time, we only had 58,000 individuals enrolled in the program. And that is the update as far as the data itself. Now, the other thing that we are doing is, as I mentioned briefly, is that we are doing some other surveys. We are currently, we do have our contract research program that is actually working on analyzing that data, and we hope to actually have that by our next meeting. But it does seem to fit in with the other information that we have gotten previously with regard to demographics. One of the interesting things that we have seen, and it actually correlates with research that's actually been being done over at CASA, and that's about the number of individuals who are enrolled in the medical program, but also are using for recreational purposes. And so discussing how much that they use both recreationally and medically. And that's been very interesting to hear a little bit about it. And what our hope is that in the next meeting that we'll be able to get the researchers who are doing that work over at CASA, as well as the individuals who are doing and working on cleaning up and analyzing the data from our survey, to be able to come on and do some brief presentations so you can see how some of the similarities that there are in these 2 different groups of researchers actually working and looking at the same questions or similar questions and getting very similar answers in them. We think that'll be a very important thing, and so we're working on getting both of those groups of individuals together to come for the next meeting. Any questions? Okay, so the one other thing that I did want to show, and can everybody still see the screen? Has it switched over to the web page? Oh, and there is a question, it looks like. Eileen?
Yeah, thank you. And forgive me, I'm obviously struggling with the phone, and apologies that I thought my camera was on, but it wasn't, and all of that. So my apologies. Thank you for such a detailed presentation, and I'm looking forward to having those guests next time. I suspect that you covered it and I missed it. Do we know about hearing you describe about people who use for medical and also for recreational? One of the things, and it's not for me to put words in his mouth at all, but one of the things that Martin had mentioned previously was about ensuring that there are that there's access for the medical program with the rollout and scaling up of recreational. I suspect that you covered it and I missed it, and I'm wondering if that is something that we can speak to at all.
No, actually, I didn't cover it, Eileen, but great question. So what I will say is that we haven't really seen issues with regard to access at this point in time. Now, what we have seen, and the types of calls we do get, is where people will say, "Oh, I can't get my cannabis. I can't get my medical cannabis," and what it actually is a specific product. So, but that's not unsurprising, especially in any new industry as it's rolling out. There's sometimes going to be supply chain issues, so to speak, and where some locations may run out of particular products. And when that does happen, we do alert the Cannabis Control Division to let them know. But for the most part, the dispensaries at least seem to be very responsive to the patients in order to try to get those products, with perhaps a few exceptions. Of course, we don't always hear about it, so we don't know about all of the situations. But in even in the surveys, it appears as though while sometimes there are issues with access, it does seem as though that's not very much, or at least it's not greater than what it was previously, and mostly is for the same reasons, which are the same reasons we see with regard to healthcare and other issues throughout the state, which is rural, lack of access, just in general, due to the number of individuals in a particular area. But we do see, at least the reports we're getting anecdotally, which of course is not data we can really use at this point, but the reports that we are getting from patients that I've spoken with, for example, have said that they have actually had greater access at this point. And so while that's not necessarily going to be the case in all regions or areas of the state, at least that is something that seems to be improving and continuing to improve. So, and by the way, we did ask those questions, and again, we're waiting on the analysis as well with regard to what happened in the survey that we just conducted. So we'll see what happens. Now, the caveat, of course, with that is we just conducted this survey this summer, so it's only a couple of months into the new adult use. What really is going to be helpful, I think, is when we repeat and or do a similar survey again in another year, so that the industry will have time. Many dispensaries, while they're open, there are many that are actually licensed that still have not yet opened, so that accessibility is still going to continue to increase, or at least we anticipate it to, over the next several months. I hope that helps. Or did it just bring up more questions?
For me, that was very helpful. I'll mute myself again so that anybody else who has questions, additional questions, can ask them.
Okay, well, and what I just wanted to also show is, again, on our educational resource page, we do have quite a few different posters and educational material for various categories and individuals. Of course, whenever we do this, we have to send it through our Department of Health communications team so they can make sure that everything, the formatting, everything is correct and labeled. We actually very shortly will also have a flyer and poster about safe use around pets. In other words, making sure that people don't leave their cannabis in a place where their dog can jump up on the table and scarf it down, those sort of things, and what the potential issues and problems could be with leaving cannabis out for pets and other animals. So, so we do have that also coming, but these are accessible to anyone. Anybody can use them. We do have them here. Again, each of the materials is in both English or Spanish, or some of them are bilingual on the actual poster themselves. And to give an idea, this is just one of them. And again, you can see that it has both the English and the Spanish throughout. And that's all that I have at this point in time. Oh, Haley, I see you've got your hand up. You had a question?
I apologize if I missed this. I'm trying to follow and take notes on my iPad, so I'm going back and forth here. But do we have data yet on safety issues? Have there been any pets or children or other safety information that's arisen since the last meeting?
So nothing in particular or in specific, but our epidemiology and response division is working with poison control in order to get updated information. Again, the big issue is that it's just been, a couple of months since adult use started. And, but we can also ask them to ensure that we have that data for the next meeting.
Thank you.
Okay, any other questions? Okay, well, thank you, everybody. I appreciate it. Are there any other questions in general with regard to the program or what the program is doing? Okay, thank you, everybody. I appreciate it. And Eileen, I will turn it back on over to you.
Thank you. And then, so next on our agenda is discussion of research and resources. And I think that, Gary, I wonder, were you leading that?
Not well. Again, Zotero is the medium that we are using, and the Zotero site. Many of you have accessed it, and I do invite you all to submit articles. There's quite a few there, and I think, for example, in regards to the child safety, the question that Haley just asked, we'll try to include that information on that Zotero site, and that's where that can be accessed. If you require any help accessing or have been unsuccessful, Kathy is a guru at connecting you all to that. We can set up a time, FaceTime, what have you, to help you access the Zotero site to have access to those articles. I think there's some great ones there, and if any of you have shared them or read them and have a theme to share, I think this would be the medium to do it in. So that's all I really have to share about that, Eileen.
That's perfect. Thank you. Colleagues, this is, like you just heard, this is a tremendous resource. I wonder if what questions you have, what comments you have about that and what Gary just told us about.
Does anybody need an invite to the Zotero site and has had problems? Perhaps maybe that's somewhere to start. If anybody's been unsuccessful, I can take that name down and we'll get in touch with you to get you connected. Turn it back to you, Eileen.
Thank you, and thank you for doing that work. Yeah, to all of you, really, thank you. What other items do we have from the committee members? This is really your time to express your thoughts, your questions, your concerns, your accolades for the amazing staff at the DOH. What other items do you have? And maybe better said, is there any additional information that you would like to have available for our next meeting? For anything that you would, oh, go ahead. Sorry, thank
Eileen,
you, Gary.
It's Dominic. I just wanted to say that, I know we're also in this little bit of an odd period because we're just a few months into adult use. And so a lot of the data is about adult use and how that's impacting is really being gathered now. But by the next meeting, as I stated, we are going to have at least one analysis from a research study that's been done this summer. I'm hoping that we'll be able to have presentation from two, and I think that will really help with regard to the data from it. And then Haley will make sure to get that information with regard to like poison control and responses there. We are also trying to get information with regard to any kind of emergency room visits and those sort of things. So hopefully we'll have some of that also. So I know while this particular meeting doesn't have a lot of that data. It's just because it's really all in progress right now, because it's still so close to the launch of adult use, which I know sometimes doesn't seem like it's the start, but it's only been 5 months. So, and it's much better. I know many times on our data side, for example, with overdose prevention data, we don't even get it for a full year or sometimes more until with regard to uh, mortality rates and things like that. So I think we're doing pretty well that we'll be able to have a lot more data in just a couple of months.
Do we have any information from
Haley,
on
I'm
highway? Yeah, sorry.
No, I'm sorry, Haley. Your vocal, your microphone went out there. You had asked if we had any information, and then you went. We couldn't hear, or at least I couldn't.
From the public safety department, from state police, or from police or county sheriffs, is there any mandatory requirement for reporting if there's suspected cannabis use behind accidents, or same I would ask for occupational safety or other issues?
That's a great question. We have actually asked for that information, but have not yet gotten it. Again, there's usually a couple of months lag on it.
So I get this would lead into another question, which is in 2 years, I guess, we need to be providing a report to the state legislature, correct? So would it be time now to start putting together at least the tables that we'd like to be filling out for then, so that we can be sure that we're now gathering the correct data, so we can include it at that time, and start at least outlining the report. That way we can make modifications over the next 2 years.
Absolutely, that is up to you. And I'll turn it over to Eileen on that. And Eileen, you've got your hand up too.
Oh, thanks. Actually, I was going to go. I thought that Haley's question was a really good one about safety sensitive positions also too. Like I think of pilots, physicians. Is that something that will be tracked as well, in addition to the other occupational issues or occupational questions that Haley had raised?
I'm sorry, Eileen, I'm not 100% sure what you mean. Do you mean as far as what positions are designated as safety sensitive, or how many of those there are in the state? And you're nodding your head yes there, so I think.
Oh, I was thinking like, oh, way to ask the question better than I did. So I think that probably maybe what is there a, I think this is a very a question that now I recognize I'm not sure what the answer is, which is there a role on providing any guidance about safety sensitive positions, or maybe that's solidly out of the purview of this work. And maybe I'll ask for that. I bet that actually that there's been a lot of thought about that, I bet.
Yeah, that actually clarifies it a lot. And that is actually something is really something that the attorneys, and from an employment standpoint, that they really need to determine. It's going to be a little bit different in each and every field, and even different workplaces, because it really does depend on how they look at safety sensitive. For example, essentially what safety sensitive comes down to is, would the use of cannabis, or really any other medication, impair their function to do their job that could potentially put them into harm's way or someone else? Now, of course, I'm not saying this in any way that's legal format or anything else, but that's essentially the issue. So when it comes down to it, then what does that include? Does that include driving a vehicle? Does that include, operating equipment, machinery? And so different workplaces are going to have different items or things that may fit with that. So somebody who is in one position in one company, for example, may not be considered safety sensitive while somebody in another company may be, because of the type of machinery or other things that they may be doing. But that's something that they each have to do. That each company has to actually provide that analysis internally with regard to what they consider safety sensitive. I hope that helps.
I thought it did tremendously. Thank you. I wonder, maybe I'll pause to see if anybody else had any follow-up questions to that.
I guess my question would be: do other states, or have they already defined some of these things that we can use, and/or has, say, National Traffic Safety Administration defined some of these things so that we can use some already well-established criteria?
What I really would say on that is it varies, and they're not necessarily, it's not necessarily always straightforward. That's part of the problem. There is so much gray area here. There are some interpretations that are extraordinarily strict and others that are much looser. So I know that's not a lot of help on that.
Was anyone at DOH sort of trying to define it or studying it or trying to accumulate that information from other states or feds?
Not at this point that I'm aware of. Again, that really falls under the areas with regard to OSHA and employment, not so much with Department of Health. But they are good questions, by the way.
So sorry that I brought us a little bit far into the weeds, and it wasn't even the weeds on our area of focus. I think I thought of it because I'm on the medical board, and I worked at a hospital where there was an attempt to try to provide some guidance. So it made me curious. And I think that also that the comment/question that I think also came from Haley was about preparing to give a report and to ensure that the data that we're collecting now sets us up to be able to provide a report, particularly in the 8 domains that that has been set out by the statute. And it is likely, I suspect that you've already crosswalked all of that in the presentations that you've been giving us, but I haven't been tracking it for that, and my apologies. And I wonder if that is something you would be able to help us best understand where that stands.
Sure. So a lot of that, it's going to end up being the committee's decision as far as what the formatting is. But what we will actually do from the department standpoint is, as we of course are gathering a lot of these data points and the research that's coming on in, we're actually going to create some of those tables, some of that information, and then really present it to you for you to be able to say, we're missing these items, we need these items, we would like to see some more information or data with regard to whatever particular subject. So I'll use the one Haley brought up about potential incidences with regard to poison control and Pat's accidental usage, those sort of things. And that way then you're not starting from square one. You'll actually have some information to be able to do that. And what we're actually utilizing for it is, in this statute, it lists out all the different particular areas that need to be included and covered in the report. And so we'll be utilizing that as the different sections, so to speak, of where to gather that data, if that helps.
So to me, it does. What I want to do is to pause for other people to ask their questions.
I was wondering what we anticipate as the timeline on this. I know that we're in the very early process of of collecting this data and putting it into a format that we can review. And I know the end of 2024 is a long ways off. And so I'm wondering, at what point do we think we're going to start to have more sufficient data, and we as a committee will start to work to actually compile this report?
That's a great question. So I think that really from the next meeting, so the end of this, towards the end of this calendar year, we're really going to start seeing some of that data, or at least enough that we can start creating the report. And as Haley was saying, building those tables. And then, of course, we'll have just some of the introductory data. So some pre and some post, for the immediate after adult use has started. And then those tables can be expanded to include the data over the next year. Or, well, I guess I really should say year and a half or so that the report can become more complete. And I think that once we start hitting the beginning of next calendar year, that's where we'll be able to say, here is the beginning basis, and now it's just a time to add on, and then really starting looking at analysis, probably in the second half of calendar year next year of 2023. And that way, and then that'll be ongoing. Does that help
That's
a little
very
on the
helpful.
timeline? Okay.
It
Great.
does. Thank you.
And just to kind of go back, during the first meeting, we kind of had said we were going to really take this first year to sort of see where things were. And so that actually fits in with where we'll be because the committee started the beginning of 2022. Actually, I think we had the first meeting in December of 2021. Is that correct? Or am I thinking the medical advisory board? I'm sorry, there are so many meetings. Sometimes I forget which one is which. But it'll be just at about a year.
Yeah, I have December 15th was our first
There we
meeting.
go. It was December. So yeah, so I think that's really where we are. And I think we're pretty well on track with where we thought we would be. I think we're actually setting a nice pace.
That's a great question and such a rich answer. Colleagues, any other questions? And I think that segues into the last item on our agenda, which is to plan for our next meeting. So then I'm also going to turn off my camera this time and to ask maybe the most obvious if this time and day of the week generally works for you. And so very specifically, I think that would bring us to November 8th at 10 if we went with the second week or the second Tuesday of November.
Eileen, I would just mention that the second Tuesday of November is election day. Ooh, so I know some people do take that day off to go and vote if they're voting in person. So we might want to do a different day or maybe even postpone till December, which would put it at December 13th. But again, that's up to the committee. And if election day is fine, that's also fine from a department standpoint. I just wanted to point that out because I know sometimes people do take that day off.
So I am so grateful that you said that, and I can't believe that I didn't catch that. I think I'm such an early voter person, but yeah, I'm sure that everybody here is too. But right, we should cherish our voting day. So I loved your suggestion, and thank you for December instead. So maybe what I'll ask is if that works for you and Gary and Chris and Brenda and everybody in the DOH office. Maybe I'll ask if people can indicate that it would be maybe with your either in the chat or your thumbs up that if December 13th at 10 o'clock works for you. And okay, thank you, Alan, for your thumbs up. And thank you, Chris, for your thumbs up. I'm going to look in the chat also on my phone, excuse me. Thank you, Mateo. Eleni, I think I'm going to defer to your judgment. It sounds like that having to change a clinical shift might be quite a big lift.
It looks like it's working for everybody else though. So if it works for everybody else, I'll ask around. Not a problem.
Okay, that's generous. If it's not able to be changed, maybe please let us know. Because we also need to, of course, your contributions matter, and also that our usual chair, Martin, isn't here right now, so I want to make sure it works for him too. And also, Gary, does it work for you? Yeah, good. Okay, thank you. So maybe next I'll ask if there is anybody else for whom they prefer a different day or time. Okay, so then maybe right now that we'll hold it for the December 13th from 10 to 11:30, unless we hear from Martin that it doesn't work for him. And also, Eleni, please do keep us posted. And I think that Hallie has raised his hand.
I'm just wondering if it would be worthwhile to consider sometime, maybe in the first quarter of next year, that we actually get together in person and give us an opportunity both to get to know each other some more and to have more informal interaction as well as formal. I mean, it's a little difficult on this with the Zoom with so many people going back and forth discussions. And by then we might have some sense of the tables and just starting to dig into the nitty gritty a little bit more, and we can then have some greater back and forth as well. So I'm just throwing it out there as a suggestion.
So this is Eileen, and I think that's a wonderful suggestion. I might ask for Dominic and Gary if that is something that has been done before with other DOH committees, and if that's any reason that we shouldn't explore that.
So it's actually was the norm up until the pandemic. So I think that is definitely something that is feasible and can be done. The one thing I would just caution on it, just to ensure that individuals who are in other more remote parts of the state can still join, that we still have the virtual option. But what we can do is we can see about setting something up in Albuquerque, since it's a little bit more centralized for most people, so that as many people as possible can come and join in. And then we would try to have, the equipment so that we at least could share with those who would not be able to travel.
I'm thrilled to hear that. Thank you. And I don't wish to put anybody in a difficult situation, but knowing that some people might be traveling from quite remotely, does there happen to be any funds for the per diem travel for people or some way to offset their travel costs? And if there's not, I don't want to put anybody in.
Yes, the department does have, for committees such as this, there are methods that we can do. And what we can do is, if that is the decision, we can actually get, because there are, of course, anytime we have reimbursement, there are forms that have to be filled out. But what we can do is we can get those and have those ready for the December meeting, and just kind of go over them maybe at the end of the meeting for anybody who thinks they would need it with regard to traveling.
Thank you. Wonderful suggestion. So then maybe at our next meeting, we can, thank you for having those available. Thank you for that wonderful suggestion. And maybe at our next meeting, we can look to see what would be the possible timings that could work for that. Okay, thank you. What other questions, concerns, closing comments does anybody have? So sounds like none. So I will say thank you to all of you. Really nicely done. I appreciate your engagement, your involvement, your sharing of your expertise and your time. And also, because we did get that reminder, I'm going to ask everyone, please remember to vote. Your voice matters. Take good care, stay safe, and really looking forward to meeting everybody in person.
Thank you, everyone.
Thanks, everyone. Have a good day.
Thank you.